Yeah, so what exactly does the treatment involve specifically for this condition?
Okay, so Ayurvedic treatment for osteoarthritis, the way we do it at AVN Arogya, has many components. It's a very holistic intervention. So when we talk about treatment, there are some patients for whom basically the intervention starts with some medicine.
Okay.
But whenever we talk about treating a patient at AVN Arogya, it comprises of a few elements. One is definitely we go through their entire history. We evaluate their constitution and understand the sort of diseases that they are prone to genetically.
Okay.
We have an Ayurvedic concept called prakriti, through which we can sort of predict what this person is prone to. So those people are particularly prone to certain conditions which predispose them to certain diseases. So right from that we sort of look into all those factors and advise the patients on what they need to do in terms of their diet, lifestyle, etc., which can prevent them from getting into those diseases early. Okay. Even if there is a propensity to get that disease, we see that they don't get into the advanced levels of those diseases. So there are several small interventions that they can do in part of their lifestyle, which can keep them healthy. So we start from there. So we have a detailed history taking at the beginning of the whole program, wherein we understand what is their basic propensity. So based on that, they are given dietary advice, they are given lifestyle related advice, and depending on where they are staying, whatever is their occupation. So there may be certain occupational hazards. There could be something to do with the climate of the place where they are staying. So all these different factors have an influence on the aggravation or perpetuation of a disease. So we factor all those and give them. In addition to the basic minimum intervention that we do as doctors is give this advice and then also give them some medicines. So that's the mildest form of intervention that we have.
Okay.
For mild conditions of the disease, just these medicines would do. When I say medicines, we mean the Ayurvedic, herbal potions we have in the decoction form. We have, and as an organization, we have innovated in terms of coming out with tablet forms and capsules with respect to these Ayurvedic medicines, which were traditionally quite difficult to consume. We have been able to innovate and come out with very modern, convenient dosage forms like tablets and capsules. To compensate for those difficult to consume legumes and kashayams and churnams and so on, which used to be the order of the day earlier. So now we are able to treat many conditions with just our new tablets and capsules and so on. So that's the minimum. Plus we would invariably, especially for an osteoarthritis, we would give them some oils for external application. And there's a lot of significance in using that oil. So oil has got multiple effects. Unlike many of the pain-killing oils, there are many things that are used just as painkillers, which are basically nothing but counter-irritants. They have some ingredients which sort of trigger the sensory nervous system and block the pain sensation from reaching the brain. So that's how many of these so-called pain-relieving agents work. But when we talk about the oils, they are not just counter-irritants. Of course, our new forms of oils also have a little bit of counter-irritants, but the traditional oils that we use are basically used depending on what therapeutic effect we want to achieve. There are oils which can help to bring down inflammation. Even within inflammation, there are specific oils which help to reduce the warmth and reddishness associated with the inflammation. There are certain specific oils to help reduce the swelling associated with the inflammation. There are certain other oils which are more helpful in relieving the pain associated with the inflammation. So that is one aspect with respect to inflammation. There can also be, especially in the case of osteoarthritis, there is this component of degeneration, which is a very important thing happening in osteoarthritis. So we have oils which are anti-degenerative as well. So we combine the different types of oils as required by that specific patient, and that combination of oil is what we generally prescribe. So these oils on external application can deliver both anti-inflammatory as well as anti-degenerative effects based on what we really want them to happen. Of course, in some cases we also add some oils with some counter-irritants to help give an immediate feeling of relief. So because pain anyway is a perception. So when you sort of help them get relief from that pain in the short term, they feel a relief, but that's not going to give a long-term relief. Whereas our oils which are anti-degenerative, when they are used on a regular basis, they give some phenomenal results, not only in terms of immediate pain relief, but also in terms of preventing the ongoing degenerative process that is the basic problem in this disease. So that is the one level of intervention where we are just using the medicines. The second level is where we have our clinics and centers in different places. We have a few in Madurai, in Chennai, in Bangalore, in Bombay, Cochin, and also in Malacca we have a joint venture there. So at our centers, we offer them therapies where patients can come, they stay in their regular home, they come to the clinic, have a session of what we call as therapies, and then they can go back home. So it's just like a daycare procedure where they come for an hour or 1.5 hours. We give them some therapies and then they go back home. So that's the second level of intervention. And then there's the third level where we get them admitted to the hospital, where they are under constant monitoring. We look at them through the whole day. They are given generally about 2 sessions of treatments of these therapies. That's what I said. In addition to the medicines that we give them. Plus also we are putting them through a particular diet program which is very appropriate to their basic constitution as well as to their disease condition. And then we also encourage them to undergo some yoga sessions if they are fit for that. There are certain stages where they wouldn't be able to, but whenever they are appropriate for that, we recommend them to undergo training in yoga. Very often yoga is also used to relieve the stress, which is very often an accompanying factor when you talk about a chronic disease. So that's another thing we combine when we talk about hospitalized treatment. We also have a physiotherapy unit at the hospital where we use all the rehabilitation techniques, the modern techniques, to help mobilize the joints, to help them get rid of pain, to relieve stiffness and all the associated complaints, and also teach them exercises through which they can keep their joint healthy and moving. So it's a holistic approach that we adopt in everything that we do. Even for the patients who come as outpatients, we recommend them to do certain exercises. We sometimes ask them to go and visit a physiotherapist to get some things if they need to, in addition to the therapy. So it's very personalized. Each patient requires a different type of intervention, and based on our experience of so many years, we have developed protocols through which we can clearly give them effective treatment. So this is the sort of treatment program that we do in AVN Arogya.